All right, let's talk about something huge that's happening right now in clinics across emerging markets. It's this incredible shift to digital medical imaging. And it's a change that means everything. Sharper images, safer procedures, and way smarter workflows. So let's just dive right in.
You know, when you boil it all down, every single medical scan, whether it's a simple X-ray or something much more complex, it's all about one thing: clarity. It's about giving a doctor the ability to see exactly what's going on, with zero guesswork. In diagnostics, being able to see clearly isn't just important, it's literally everything.
And that leads to a really important question for anyone in healthcare. Is the technology that you depend on, day in and day out, really giving you what you need? Is it delivering that absolute certainty that's the foundation for every confident diagnosis, for every effective treatment plan? It's something to think about.
So this quest for certainty, right? That's the engine that pushes medical tech forward. For years, conventional X-rays were the best we had, but let's be honest, they had their limits. Well, now we're finally moving past them.
And wow, when you put the old and new ways side by side, the difference is just night and day. The old conventional way was slow, it was clunky, you had to deal with physical film. But the digital approach, it's instant. It uses way less radiation, which is a huge win for patient safety, and it all just flows together in a modern clinic. This isn't just a small step up, it's a total game changer for the whole process.
So, what's the magic behind all this? What's the engine driving this revolution? Well, it all comes down to one amazing piece of tech: the Flat Panel Detector, or FPD. Let's pop the hood and see how it works.
Okay, so in the simplest terms, the FPD is what takes the place of that old film cassette you'd slide into the machine. It's this super sensitive surface that catches the X-ray and bam, at a split second, turns it into a perfectly clear digital image right there on your screen. No film, no nasty chemicals, and absolutely no waiting around.
So how does it pull this off? Well, it's built on a few really solid tech pillars. You've got advanced silicon technology that gives you incredible precision. Then there's a special material, cesium iodide, that creates amazing contrast so you can really tell the difference between tissues. High-res sensors capture even the tiniest details you need for a good diagnosis. And the big one, it has optimized exposure control, which means you get these fantastic images while using a lot less radiation on the patient.
Okay, so the tech is super cool, but what does it actually mean for the people on the ground? The doctors and, of course, the patients? Well, this is where it all comes together to create a whole new standard of care. In the end, it all comes down to this one simple truth. This technology delivers images with a level of detail and sharpness that you just couldn't get with the old systems. And when you have better images, you get more confident doctors making better diagnoses. Period. This boost in accuracy isn't just one thing. It's a bunch of factors working together. The amazing resolution lets clinicians spot things they might have missed before. The excellent contrast helps them see exactly what they're looking at. And since it's all digital, you get far fewer of those annoying smudges or distortions, artifacts, that could hide something important. Better yet, it's already built to handle future tech, so it's a smart move for the long run. And we have to circle back to this because honestly, this is a massive deal. The incredible sensitivity of these detectors means you get a perfect image with a much lower radiation dose. For patient safety, that is a gigantic leap forward. And look, don't just take my word for it. This really says it all. We heard from a clinic partner who's already using this technology. And what did they say? They highlighted two key wins: the incredible image accuracy we've been talking about and the speed, which completely changed the game for their clinic's workflow. Okay, let's dig into that idea of efficiency a bit more, because the impact here is so much bigger than just one picture. We're talking about redesigning the entire way a radiology department operates. Just look at how smooth this all becomes. First, the image is captured instantly. Then, it pops up in this really intuitive software where you can tweak it and review it, and from there, it shoots directly into the hospital's main patient and radiology systems. It's just one smooth, connected, and incredibly fast process from start to finish. And when you put the two workflows next to each other, it's not even a contest. With the FPD workflow, the time you spend with each patient drops like a rock. You get the image immediately, not minutes later, and all the data is managed automatically. This is such a leap in efficiency that clinics can see maybe 20% more patients a day. Think about what that does for wait times and access to care. It's huge.
And the really cool thing is, this isn't some rigid one-size-fits-all system. The beauty of this technology is how flexible it is.
You can use it in your standard X-ray rooms, sure, but also in mobile units right at the bedside or for moving images like fluoroscopy. And here's the kicker. It can be used to retrofit and upgrade the equipment you already have, which makes the whole switch much more affordable.
Now, having amazing tech is one thing, but that's really only half the story. For any clinic or hospital, especially in emerging markets, you need the right partner to help you actually put it to work. And that's exactly where a company like IHD steps in.
Their mission couldn't be clearer, and it's powerful. It's all about empowering healthcare systems across the Middle East and Africa by bringing them not just this incredible technology, but also the expertise to make it all click.
So what does that mean for a clinic on the ground? Well, it's huge. It means you're not just buying a box. You're getting expert support to make sure it fits perfectly into your workflow. It means getting those flexible retrofit options we talked about, having technical help available 24/7, and most importantly, working with a team that truly gets the unique challenges and opportunities in the region. And all of that boils down to these three things that every clinic manager dreams of. First, reliability. These things are built tough. Second, confidence, knowing you're covered with things like a solid warranty. And third, usability. With software that's so easy to use, your staff can focus on the patient, not on fighting with the technology. So as we've seen, this is so much more than just a new piece of gear. It really is a fundamental step into the future of what medical imaging can be and what it should be.
This technology really does represent a new era of being certain about a diagnosis. So the question isn't really, can you afford to upgrade? The real question is, for any clinic that wants to provide the absolute best care possible, how can you afford not to embrace the clarity, the safety, and the incredible efficiency that modern digital radiography brings to the table?